So I just gotta say, like, I'm totally in love with energy medicine, with acupuncture, with holistic healthcare, with manual medicine, with putting our hands on people, with creating an environment of safety, creating an environment that downregulates the nervous system. I love that medicine. And it's only been in the last few months that I have had an interest and investment in what I would call physical medicine, more the sort of biochemical, molecular biology, what's happening on the cell level, how does tissue healing and repair happen on a physical level when we're not talking about meridians or, the other areas that definitely enrich wellness as we know and are all committed to. But thinking that, maybe there's some areas that I could grow to better understand that. And part of what's come out of that is a much deeper understanding of hyperbaric oxygen therapy. And I thought that it was just going to be like, kind of a nice thing. You breathe a little oxygen, you feel a little better, you feel a little warm inside. It calms you down. It's just like a nice adjunct to acupuncture or chiropractic was kind of what I thought it was, a way to downregulate the nervous system without having to provide manual, hands-on craniosacral type care. And I got to say, I was totally, completely and positively underestimated the value and power of this medicine. And that in the last 2 years, the volume of research on what's happening when you put oxygen under pressure is astounding, in particular because of the huge benefits for hyperbaric oxygen therapy around COVID. And so we've seen just an explosion in this medicine, and therefore an explosion of the understanding of the biomechanics and what's happening. And then therefore thinking, how can we apply what we understand about what's happening in this area to what could possibly be happening in other areas of pathophysiology. So I think if we were to super duper oversimplify illness, we would think that, at least from a Chinese medicine perspective, a big thing is there's not enough circulation. We always go back to that with acupuncture, like where there's stagnation, there's pain. And then secondary, if we're oversimplifying illness, would be the body's inability to communicate with itself. It's not having access to its own innate resources for healing. And in Western medicine, the body's ability to communicate with itself, that's called cell signaling. And stimulating circulation and cell signaling are two of the main mechanism of actions of hyperbarics. And they don't do this a little bit, they do this a lot of bit. Like a lot. And the other thing that really is kind of blowing my mind about this is that the chambers are accessible. They're easy to operate. Literally, it's one switch and a zipper, and that's it. It's like, are you kidding me? I have access to something that's going to cause profound changes in circulation and cell signaling, and all I have to do is zipper and push a button. Like, and I have one in my clinic already, So just to get right off the top, there's only 2 contraindications. If you have sinus pressure and you're unable to clear your ears, like pop your ears, then it's not safe for you to go into the chamber. It would just cause discomfort in the tympanic membrane as the pressure is changing, kind of like going up on an airplane. And the second contraindication is pneumothorax. And this is because the oxygen volume inside your body needs to be able to pressurize with the pressure outside of your body. And if there's a hole in your lung, it can't do that. So that's the only main contraindications, just get those off the top. And I think one way that I've been able to kind of digest this material is to apply it to what I already know about holistic healthcare and Chinese medicine. And we think that the blood is, that's the money, right? The nutritive quality of your blood is what's going to facilitate healing, at least from a Chinese medicine perspective. And then your body's access and to get to that blood. And what if, when we think about our blood, we don't just think about what I would think the nutritive quality of the blood, but we really think about it as oxygen. You know, that is most of what your blood is red blood cells carrying oxygen. And what if we were to look at oxygen as a nutrient, or look at oxygen like a supplement? And what if there was something that we could do that would increase the body's capacity to carry oxygen by just a huge fold? So we think about that, just the benefit of the just fundamental, super basic, fundamental benefit of oxygen in the body. It's required to breathe. Every cell needs it. When the cells don't have it, they become hypoxic. A reason a cell wouldn't get it is from injury or illness. If we can add oxygen to those injured or ill cells, they recover. Like this, we know about the body. And what happens under pressure? Normally, your red blood cells, you think you have a pulse oximetry meter, it's at 98%. You think my body's already got all the oxygen it can possibly take. It's got 98% on a pulse oximeter. I'm doing fine, right? What happens under pressure, when you put the body under pressure, is there's 2% more of blood. 98% is being carried by your red blood cells. That's your oxygen, your red blood cell oxygen carrying capacity. The other 2% is called free oxygen. And that's oxygen that's just floating around in your tissues that's not been assigned somewhere. What happens under pressure is the law of solubility. A gas under pressure becomes a liquid. We literally get more oxygen into the liquid tissues of the body, primarily blood, plasma, cerebral spinal fluid, lymph. And the increase in free float oxygen in a hyperbaric chamber is from 0.3 milliliters out of 100 milliliters to 42 milliliters. That is a mind-blowing number, just exponential beyond exponential beyond exponential. From 0.3 to 42 milliliters is the increase in free float oxygen in the blood. This creates a pressure gradient. You think that, you know, gases or things flow from high concentration to low concentration, which this means that the tissues that need oxygen are going to be like, they're going to get it. The way that this happens is you get in a chamber, you add pressurized air, which changes the atmospheric pressure inside the chamber to 1.3 atmospheres, which is the equivalent of going underwater about 10 feet when the pressure increases. So it's not like a dangerous amount by any measure. And then we add a concentrator of oxygen. So you breathe oxygen in a mask under pressure. The concentrators we have at the clinic are they generate on demand 94% oxygen. In order to get higher than that, you have to have a green tank, like oxygen tank, like scary explosion. Like I'm not going to do that. So we have on demand oxygen, which is very, very, very safe. And the pressure goes to 1.3 atmospheres. Super, super, super safe for the body. Like nothing bad is going to happen here. One thing I will say is that when you increase the oxygen in the body, because every cell needs oxygen, the medicine or the therapy goes everywhere in the body. So it is a little bit hard to target. If somebody has an elbow injury, their whole body is going to benefit. One way that we can do that would be to use a laser in the chamber to kind of cause some vasodilation at that area to help the body bring even more oxygen there. But the increased fold of oxygen is so huge that you don't even really need to target it because everywhere is getting plenty. And I would like to take a little minute to talk about the two main mechanisms of action, one being or benefit really, one being what I would call like mechanical. So what's happening on a cell level when the cell gets more oxygen? Fundamentally, and we can go into more the microbiology of this if you have questions about it at the end, but fundamentally it makes the cell make more energy. It facilitates the mitochondrial's capacity to produce ATP by an incredible fold. A normal cell will produce like 2 ATP. Under pressure with oxygen, it will do like 32. This means the cell is waking up and it has the energy reserve to do its function. And then that cell can function better. And when that happens, one, the cell has more energy to do its purpose. And then two, it's more efficient, which reduces the like cell waste. The cell becomes more efficient, and then your body's toxic load goes down because your cell's respiration is more efficient and productive. So just on that level, if the only thing that hyperbarics did was increase your ATP and reduce your toxic load, that would be amazing, especially at the volume that the studies show it happens. Coincidentally, there's something else that happens when the body is put under pressure. And the closest kind of analogy I can think of to this in the medicine that like Amy and I would understand would be around moxibustion. And part of how moxa stimulates the immune system by activating the heat sensor proteins. So we have these proteins in our body that sense heat, and those then send a cascade to activate the immune system, which is part of how moxibustion works. It's similar in the sense that under pressure, we have oxygen sensors that notice when the body is under pressure, and they go, oh, wait a minute, something big is changing with the main super important thing, oxygen. And and so the cells start talking to each other. And the things that increase in that sense are cytokines and serotonin. How do you say it? Sirtuins, sorry. The main one that gets stimulated is called HIF1, which is hypoxia-induced factor. So when the body thinks that it's going hypoxic, it starts to grow. It is like, wait, save me. And this is, hyperbarics can induce what's a relative hypoxia. So we're gonna put way more oxygen than the body could ever possibly use on land. And then maybe we'll take your mask off for 5 minutes. And then your body goes, wait a minute, now I have less, even though it's still way more than it ever needed. So it's a relative hypoxia, which triggers HIF1 to activate, which then triggers collagen and fibroblast production, which is why hyperbarics is really powerful for wound healing. And one of its primary uses in hospitals is wound healing, because it will stimulate collagen and fibroblast production like nothing else that medicine has. It will stimulate stem cell proliferation, both mesenchymal and central nervous system stem cells, 8-fold. 8-fold, you guys. That is unlike anything else in medicine also. And it is from stimulating the body's own response, right? It's stimulating your own stem cells as opposed to like injecting them from the outside or something. It stimulates erythropoietin production. And then the big one, when you think about adding oxygen, you think, oh, oxygen is toxic. Wait a minute. That's going to create free radicals. That's going to oxidize the tissues. That's going to be bad. Actually, the opposite happens, because when you endogenously inside of the body add oxygen, it does create a free radical response called reactive oxygen species. But the body's innate, like mere response to that is to then stimulate superoxide dismutase, which is the body's internal way of combating oxidation. It's the body's like powerhouse for antioxidants, which will help to eliminate free radicals from the tissues. This is huge for any kind of inflammation for cancer, for tissue damage. I mean, stimulating the body's capacity to eliminate free radicals in a huge way is why, you know, if somebody said, oh, oxygen is toxic in this scenario because it's endogenous and it's stimulating the body's capacity to meet those reactive oxygen species, it's actually productive. And I will say that there is a benefit also coincidentally to stimulating the body's endogenous reactive oxygen species, because that's what our leukocytes and white blood cells use to kill. They do leukocyte oxidative killing. They use that reactive oxidative species to then run around and kill bacteria and viruses. So coincidentally, it's also stimulating the body's immune system and fueling it with the chemicals that it needs to go and kill bad shit. Another thing that happens under pressure is you would think of this intuitively, vasoconstriction, to the degree that it will help reduce cerebral and vascular edema, pain and swelling anywhere in the body. So would be a fabulous idea post-surgery, post-injury, post any boo-boo on any level wherein there's swelling, pain, and edema, including head trauma. Your brain is swelling after a car accident, you get in the chamber to stop the cascade of inflammation and damage. As a product of this chemical reaction that happens with the reactive oxygen species, you get reduced intravascular leukocyte adherence. That means that inside of your capillary walls, if there's damage to those capillary walls, your immune system creates an inflammatory cascade, which sends lots and lots of leukocytes, lots and lots of red blood cells to that damaged tissue, to those damaged endothelial linings. And oftentimes that immune response is so strong that it actually occludes the vessels and creates more problem. So what under pressure happens is a reduction in the intravascular leukocyte adherence. The white blood cells get less sticky. So basically it's like putting a wait, not so much on the inflammatory cascade. And this is going to happen for any injury or illness that is having too much inflammation. And just by adding oxygen and ATP to the cells, all the cells that have all of their various functions, in particular your white blood cells, their function is going to be increased, whilst they're not being so sticky. Another thing we see is antibiotic synergy. So the studies around this are interesting. They haven't figured out how to measure this in blood marker, but seeing it clinically, it's observed that under pressure, biofilms are reduced, which would mean that an antibiotic resistant type bacteria, antibiotics can get to it now. So it's gonna, if you were of the mindset to use antibiotics, if they're a little bit resistant or we're having a hard time, it's gonna make them more effective. And clinically, we're seeing not only just biofilm thinning, but total elimination of biofilm, which means that this medicine can be effective for, and we'll get down to the list of conditions that are approved by insurance, but some pretty scary viruses and bacteria systemically in the body. Another growth factor that's stimulated under pressure is angiogenesis. I think this is probably my favorite benefit, in particular for the conditions we treat. But you stimulate HIF1, the cell signal will stimulate VEGF, which is a vascular endothelial growth factor. And we start to grow new baby blood vessels everywhere. Grow new baby blood vessels in your brain. If you have, dementia or a head injury or a stroke, grow new baby blood vessels on your skin. If you've been burned by a 3rd-degree burn, grow baby new blood vessels. If you have some hepatic toxic situation, grow new baby blood vessels. If you have just a really severe injury, like you got hurt, you have a bruise, you hurt your body, it's going to help you repair and rebuild microcirculation. Shut up, you guys. It does this. Like not a little bit, but a lot. Like measurable. Like change quality of people's lives level. Okay. Toxin inhibition, we talked about this a little bit. If you increase cellular function and the efficacy of the cell increases, the cell is going to have less waste. And toxics in the body in general are the cell's own waste. And then we have our liver and kidney and other organs to help purge that. Sometimes they don't have enough capacity to keep up with the inefficient cell health, which is part of what chronic illness is. So we literally facilitate the capacity of the cell to do their work better. Cells make less waste and byproduct, body is less toxic. If there's organisms in the body that are no good, viruses and bacteria, mold, things like this, and in a hyperoxygenated state, they're not going to be so happy. You think like you sneeze on the counter, the virus dies, right? It's from oxygen exposure. You hyperoxygenate the tissues, the virus dies. Part of the problem with toxic overload can be like you think candida die-off or something like that. Once we've shocked the system, and then there's a lot of waste product from all of the dead organisms. This is something that we have to kind of keep an eye on with some of our, more sensitive patients, to make sure that we don't treat them too much too fast, such that they have a herxing reaction. But there's totally ways to mitigate that. And there's a study right now that shows at 2.6 atmospheres, hyperbaric oxygen will kill active Lyme. And at 1.3 atmospheres, which is what we have in the clinic, it's going to be profoundly supportive for chronic Lyme, for all the things that we're talking about. So in terms of growth factors that get signaled, and we think of this, these are all cell signals. When the body goes under pressure, the oxygen sensor, it's like the oxygen sensor in your car. We have these cells that are oxygen sensors. They go, wait a minute, everybody wake up. BDNF wakes up, brain-derived neurotropic factor. And this is something that there's a lot of research around right now, understanding that if there's too little of it, people have Alzheimer's, poor neural development, neurotransmitter dysfunction, depression. So having more of it is going to be good. It's going to slow the progression of those neurodegenerative progressive diseases, which we're seeing clinically in lots of studies, slowing MS. One, because it slows it from increased BDNF, and then two, because of we haven't gotten to this yet, but right here would be neurogenesis. So not only is it angiogenic, growing new baby blood vessels, it's neurogenic. You're going to grow new neurons and synapses. This can be measured. And we're starting to use hyperbarics for traumatic brain injury and stroke because it's that immediate and notable. Another growth factor that's activated is parasite-derived neurotropic factor, which I didn't know much about this one. I'm learning about this one myself. But what's cool about this one is it recruits immune cells to combat inflammation and enhance tissue repair, particularly in the heart. super awesome possum. A little bit about the history of hyperbarics. So it's been around for about 130 years. Its first use was for Caisson's disease, which is like the bends, basically. You go under pressure too much, too fast, or you come up too fast. You get nitrogen bubbles and decompression sickness, and that's bad if you're a diver. And they discovered that putting people back under pressure and then bringing them up slowly, you could combat and reverse the decompression sickness. So that was the first use of the chamber. And then that was about 130 years ago. And then the next guy to use it got excited about using it for cancers. And everybody thought he was a bat case. And then I don't know quite what happened between that guy who was a bat case and it's sort of common practice in medicine now. But right now, HBOT is FDA approved. It's considered to be sort of inherently safe. You add oxygen to the body knows what to do with oxygen. It's not at a toxic level at all. It's totally non-invasive and it's common practice. There are 14 conditions that are sort of like globally recognized as like Medicare will pay for insurance that we use hyperbarics to treat in hospitals right now. These conditions are all what I would consider like life and limb saving. So right now, for the most part, hyperbarics are used. If you're going to die within an hour or a couple of days, this is our Hail Mary last chance to save you. We will put you in a chamber in a wound clinic or in a hospital for $3,000 an hour. And guess what? You don't die because the hyperbarics was that powerful. It saved you at the very end of the brink of your death. So why not use it a little bit sooner? Because there's no side effects, right? So I think it's important to go through really quickly the 14 conditions that are covered by insurance, especially if we're looking at the pathophysiology of these conditions and the reasons why these conditions are supported. We can use like rational clinical judgment to think if it works for that, it will work for this other thing. And then we'll talk about what are the off-label functional medicine uses that there is substantial research showing its safety and efficacy for, which are the things that we'll be using it for in the clinic. Okay. But I'm going to hit you with the big scaries, the 14 big scaries. It's approved and effective for central retinal artery occlusion. This is a stroke in your eyeball. If you're going blind, to save your vision, they'll put you in a chamber. In one session, will reestablish blood flow and or new baby vessels to your eye to save your vision. So I'm going to hypothesize, if it works for retinal artery occlusion, and this is a systemic medicine, oxygen in every cell of the body, why would it not insurance pay for it for all artery occlusion? It definitely works for that. There's research for that. There's a little bit of bureaucracy in this medicine, the people who are offering it, trying to keep it at $3,000 an hour. There's reasons, but physiologically, yay, hyperbarics will save your vision. Carbon monoxide poisoning, scary. How it helps with carbon monoxide poisoning is by reducing lipid perioxidation. Okay, so if your fat cells are getting oxidized from trauma, that's part of what happens with carbon monoxide poisoning. But that happens with all sorts of other illnesses, wherein we start to lose the integrity of your fat cells, which would include your hormones, which would include most of your brain tissue, your cell membranes, your myelin sheath, which is why it's effective for MS. Mitochondrial and neutrophil membranes are all things that are based on lipids. And if hyperbarics helps prevent the profound breakdown of lipids such that it would support carbon monoxide poisoning, which is going to attack your lipids for sure, why not think, yes, this will support other things that the pathophysiology is lipid breakdown, like MS. So amazing off-label use right now, MS. Gangrene, if you have gangrene, they will give you hyperbarics in the hospital. Crazy bad infection. And interestingly, the exact same chamber that we have is the same dose and oxygen that they would use to treat gangrene in the hospital. That's how powerful the tool that we have in the basement is. For the things we talked about, fighting toxins and breaking bacteria. The fourth approved condition is a compromised graft or flap. So if you have surgery and your graft doesn't hold or your flap doesn't hold, and you're going to die, they will put you in the chamber and you will grow new baby blood vessels around your graft. And then 3 visits. Like, who knew that we have this powerful medicine that is completely underutilized in holistic medicine and completely underutilized, I would say, even in Western medicine. And just a little divergent here, part of what's bringing this to everyone's focus, like I said before, is the fact that it's effective for COVID. So people were looking for, how do we bring people back from the brink of death of COVID? COVID is a vascular disease, primarily, not pulmonary. It's vascular. It attacks the endothelial linings of your blood vessels. People can't uptake enough oxygen because they can't get the oxygen into their blood vessels. It's not because the lungs are not breathing enough oxygen. It's because they can't uptake the oxygen into their tissues. So hyperbarics hypersaturates your tissues, so you don't have as much of an uptake problem, and then also promotes all of this healing. But that's why I know about this now, why this research is becoming available. Anyway, crush injury. So you get crushed by a car, like literally crushed, crush compartment syndrome. They're going to put you in the chamber if you have extreme blood loss before they can get you to surgery, because your body can use the oxygen, the free oxygen, instead of the oxygen on your red blood cells. If you don't have enough red blood cells because you just lost all your blood to a crush injury, you can stay alive in a hyperbaric chamber, living on the free oxygen, basically indefinitely. Like, most of the blood of your body can leave. You can go in a chamber and basically be fine.
Oh, Dessa.
What? Okay, delayed radiation injury is approved. This is the kind of injury that happens, this breaks my heart, from chemotherapy and radiation, that after you've done your chemo and radiation, your tissues continue to break down. Your good tissues continue to break down from the trauma, so much so that you're about to die from after having chemo and radiation, that they put you in the hyperbaric chamber to stimulate your mitochondria, to stimulate your cell membrane growth, to bring you back to life. It's insurance approved for that. Idiopathic sudden sensorineural hearing loss. This is when, for people have no reason why, that's idiopathic. Sensorineural, your nerves in your cranial nerves stop working and you can't hear anymore, and nobody knows why. Just sudden hearing loss, cranial nerve dysfunction. Put you in the chamber, 80% of the time you regain your hearing. You know, there's hypothesis around this is that when that happens, which is, we're seeing an increase happen in this post-COVID, that the COVID virus attacks the cranial nerves, And this is why the incidence of idiopathic sudden sensorineural or hearing loss is so huge right now. And we're thinking that because of the impact that the hyperbaric oxygen has on viruses, that it's so antiviral that you get your hearing back. So if it works on that cranial nerve, why not all the other ones? You know, okay. It's approved for necrotizing soft tissue infection. And this is because of the antibiotic synergy. If you have a necrotizing soft tissue infection, probably antibiotics aren't working. The antibiotic synergy with hyperbarics is so strong that you'll get to keep your limb. Like when the option is, do we cut the limb off or not? Like loss of limb situation, they put you in the chamber and you have enough cell differentiation and vascularization to save the limb. And compounded with the profound antibiotic synergy to fight whatever is this necrotizing infection. We talked about this a little bit, super severe anemia, like you have really profound blood loss, you're going to still be able to get oxygen. Thermal burns, I think that's 14. That's the last of the approved indications. If you have a burn, 3rd degree, over 20% of your body, they will use hyperbaric oxygen to help you regrow your skin. I kid you not, regrow your skin. And not even all burn centers have one. Because of the angiogenesis and collagen formation and fibroblast formation and the capacity to rebuild your microcirculation. Not to mention the anti-inflammatory, antimicrobial, antibiotic properties that are going to help if you have a huge burn. So if you have a huge burn, why not use it if you have a burn only over 5% of your body? Why not you torched your hand, well, it's only 4% of your body in a cooker. But right now, the insurance isn't going to pay for you to have hyperbaric oxygen therapy. It's the same chamber I have in the basement. Okay. So what's exciting for us are the off-label conditions, because we're never going to treat any of that scary ass shit. I don't want any of that in my office, you know, except maybe like a burn or a little something, something, you know. But yeah, no. Okay. Things that we can, that there's fabulous studies for, but insurance doesn't pay for, but fabulous studies showing the safety and efficacy for off-label conditions for the FDA approved device that we have. Autism. Okay. That's not enough blood flow to your brain. Basically, it's not enough perfusion to your brain. In particular, the studies around children for whom don't have enough perfusion to the language center. After about 60 sessions in the chamber, these children are starting to speak. And I saw it happen when I was just at the training in New Jersey last week. I saw a girl, 5-year-old girl, get out of the chamber and say, hello. Okay. MS, we've talked about a little bit. It's not approved for insurance, but it helps. It helps slow the neurodegeneration, and it helps repair the tissues. So it's not a cure for these chronic things. It's not a cure, but it's something that can profoundly affect the quality of life. Stroke. The research is showing that if there were a 15th approved for insurance diagnosis, it would be stroke. And it's just kind of like waiting for the powers that be to do that, because there is so much research. And like I said, stroke for your eye is approved. Why not stroke for your brain? And this, I'm thinking, would be supportive for both, like in an acute phase, if you can't stop it, and then certainly post-stroke to help regrow your neurons and rebuild your microcirculation. So basically help regain total body nervous system function. And this is a bit what we're using it for now. And in that same category would be TBI, traumatic brain injury. Similar pathophysiology, similar benefit. I can share that right now we have patients who are edging up on their 60th session in the chamber, whom when we started working were in bed 22 hours a day, and now they're up and about, speaking regularly, riding in cars, you know, huge clinical shifts that I'm seeing with my own patients around TBI. Post-traumatic stress disorder, you think if this is going to support your lipids, it's going to support your hormone regulation, it's going to support your serotonin and dopamine, it's going to help with mood and anxiety and depression. Great studies around this. Parallel to this are some studies around, they're just starting to actually release the first studies around using it for supporting around alcohol dependence. And so awesome. And then infections of all sorts, not gangrene in my office, but SIBO, small intestine bacterial overgrowth, herpes, shingles, Lyme. Yes, we can treat that. Chemical sensitivity, right? You think this is like a toxic overload situation. Fibromyalgia, definitely. Chronic fatigue, definitely. Main support is going to be around the ATP production. Like, can this body make enough energy? Really great studies about using HBOT to treat chronic fatigue. Everyday musculoskeletal injury, sciatica, herniated disc, torn meniscus, you know, soft tissue injury. Like if it helps with impact crush injury, and insurance pays for that, and it saves their lives, it helps. Like if somebody has tennis elbow, it's definitely going to help. You know, like dementia, migraines, those are the kinds of things that we're going to be treating. Seems worth making, and I have not had in my practice a huge focus on oncology. I would be willing to, you know, because our clinic mainly focuses on chronic illness and neurological conditions, but it's definitely worth a big shout out to the benefits of hyperbarics for cancer. One, like we talked about, how it's going to help with tissue recovery to remediate the significant impact from radiation and chemotherapy. But two, the other thing about cancer is that it's considered to be a metabolic disease, which means that the cells, the cancer cells, the reason they're cancer cells, the metabolic dysfunction is in the mitochondria, which is directly what the chamber supports. So if that broken cancer mitochondria can't tolerate the oxygen, that cell will die. It will apoptosis, boom. If the cell can get on board with the new oxygen, that will help to potentially increase the function and regulation of the mitochondria and slow the cancer or reduce the tumor. Fabulous study. Big tumor, hyperbarics, small tumor. Because of that, the effect on the mitochondria. And then another thing, when I think cancer, I think tumor. I think tumors love blood flow. Tumors love angiogenesis. That's bad. You have cancer, you don't want angiogenesis. It's actually the opposite. So angiogenesis that comes from oxygen saturation supports healthy tissue only. I'll say that again. Angiogenesis that comes from oxygen saturation supports healthy tissue only. Because tumor blood flow is stimulated from like increasing glycolysis and other things. Adding healthy angiogenesis doesn't make your cancer grow. If anything, it supports your immune system and apoptosis of your bad cancer cells, and it helps with the recovery profoundly from the chemo and radiation. Like if you're going to die, if your chemo is going to kill you and you're not done treating your cancer yet, then they do this. So yeah, just a shout out to that, even though not a huge focus for me, but something interesting. Most of the protocols that are being used for these 14 treated conditions are, between 1 and 3 sessions, like life or limb save, not intended to actually repair the tissue and help them get healthy and better. Just get them back into emergency mode, out of critical life and limb mode is what it's being used for right now. So a typical protocol in our office for an off-label condition is probably going to be somewhere between 5 sessions and 60 sessions, depending on what we're treating. So 1 to 5 sessions going to have a good response, like cold and flu, acute soft injury, tennis elbow, or like antibiotic synergy. Somebody has a bladder infection or something. 10 to 20 sessions, we're going to be looking at chronic soft tissue injury, severe rotator cuff tear, meniscus tear, herniated disc. Planning for pre or post surgery, you should definitely get hyperbarics before you get surgery. Like ramp up your body to be able to take damage and then get in the chamber again after you've had surgery to repair the damage that from the cutting. So I would say 10 to 20 sessions pre and post surgery. Migraine headaches, 10 to 20 sessions. When we start getting into more systemic chronic things like depression, anxiety, and PTSD, where studies are showing more like between 20 and 40 sessions. And this is, and I will say the thing about this is lasting impact, because you actually grew the new blood vessels, you grew the new nerve cells, you stimulated your white blood cells. So it's not the kind of therapy that you particularly become dependent on. It's like you remind the body of how to function. You remind the cell signals, the body of how to communicate with itself. It turns on, it repairs, and you're pretty good. And then maybe some stress happens, another accident happens, we do another round of care for another reason, potentially, but it's not the kind of therapy that is like, now you have to be breathing 50,000 times the amount of normal oxygen for the rest of your life to maintain this degree of health. It's not that. I will say on that note, for autoimmune dysregulation, like Sjogren's, it's super effective for autoimmune type skin disorders, eczema, lupus, rheumatoid arthritis, Hashimoto's thyroiditis, any kind of autoimmune dysregulation is going to be supported by proper regulated cell signaling. We're looking at the research is showing between 40 and 60 sessions. Right around there is like chronic viral bacterial infection. So Lyme, SIBO, these people, their systems are shot. So 40 to 60 sessions to see, like quality of life change. And neurological conditions as well fall into that category, TBI and stroke, 40 to 60 sessions. And for those ones that are in that last category that are chronic degenerative diseases that we're working to support the body's capacity to meet vitalistically, they may need to do another course of treatment, in another 6 months or something. So maybe they'll do 60 sessions or 45 sessions and then take a few months off and do another 45 sessions and take a few months off and do another 45 sessions. If we're combating something that is degenerative by nature, as opposed to like an injury, right? It's kind of like the difference between injury and illness with the dosing and frequency. Yeah. Other things that might come up, the idea of, it's not even worth mentioning. Yeah. That's what I have to say. That's what I'm super excited about. And I think it is the kind of thing that we can use as a complement to all of the beautiful medicine that we're already doing, and to layer and stack these therapies, which we're already doing right now. we're, you know, layering chiropractic on top of acupuncture. And hopefully we're going to be layering somatic trauma therapy from Christo on top of acupuncture. And hopefully, you know, we're laying like diet and nutrition support and herbal support from Paige on top of chiropractic functional neurology from Kimber. Like, we're already layering therapies to create a nest and container of support and transformative wellness. This is just another layer that we have access to, that is a huge honor to have access to. Yeah. Does anybody have questions that hopefully I know the answer to, or if I don't, I can source this to? Do patients go once a week for HBOT, twice a week? So frequency is a big variable. So for some of these chronic things like Lyme or a nervous system related disorder, you're going to want to go every day for 45 days. It's a commitment that will change their life. If it's, you know, anxiety and depression, something like that, maybe once a week would be a really nice change for someone. And then there are other things that are going to recover in a total of 5 visits, you know, where it's just going to be like the support that a relatively healthy person needs. I forgot to mention that it's also being used in sports medicine right now, that, you know, triathletes are using it before and after their marathons for just base level tissue recovery. So I have a patient right now, she does Ironmans. She comes in, does 10 sessions before her Ironman, does 10 sessions after her Ironman. This patient that I have right now has she has torn labrums in her hips. That's excruciating. And she has no cartilage in her knees. She's in her 50s doing Ironmans. She has no pain with the hyperbarics. So yeah, frequency definitely is very condition dependent. But I will say that at 60 sessions, when your stem cells are at 8-fold, when you stop doing the therapy, another 90 days later, the study shows they test your markers again, they're at another 6-fold. So it not only turns on your cells' healing capacity, but then your body remembers and continues. So it's not like a stem cell injection that you need every couple of years because you're whatever. It's reminding your own body. And I'm thinking, there's no way this can be true. This is just crazy shit, except that it's improved by insurance. It's being used by hospitals. These are the crazy ass conditions that it's treating effectively and safely. It's real.
Dessa, can I ask you a question here?
Yeah.
First, I'm driving up to the clinic in half an hour and I'm getting in the chamber.
Yeah, I know, all of you.
So where my mind goes is, what's our relationship with oxygen to begin with? And I'm imagining, like, for all of you, you've got a patient on your table, you're giving them some sort of a massage, some sort of body treatment. You lift up their head to do some work there with the occiput. You're there and you let your hands down and the head stays up because they're so damn clenched and their breath is just tight. They're not even, there's sort of this whole thing happening. They're not taking in full breaths. The tissue of the body is all clenched. So what's happening? They live in the city. They're not physically active. They're not exercising. Like, what's the basic state of affairs with our relationship to oxygen?
It's exactly that. It's exactly that. It is fundamental. It is like the number one thing next to water that the body needs for wellness. And I think that a big part of what I do in my practice in advance of hyperbarics is teach people how to breathe and teach them, like, what happens when you're stressed and you finally take a deep breath. The autonomic downregulation of the nervous system, extremely healing and powerful for not only regulating your tissues, but also regulating your mood and emotions.
So Dessa, am I right that what's happening then, if there's a disconnection with oxygen, just someone comes in, ordinary, everyday kind of thing, you give them, you put a hand on their body. or they know that they feel that you're attuned to them, and their
Yeah.
body starts having a different relationship to oxygen. That starts opening up. And that's just one of the main channels of healing that's happening. And you're
Exactly.
saying this, what's happening is the chamber grabs at that mechanism exponentially.
Yes. Yes.
Yeah.
That the main pathophysiology of chronic illness is lack of breath, lack of movement, lack of circulation. This is treating the primary pathophysiologies of chronic illness. Circulation, oxygen, cellular ATP dysfunction from some sort of toxic overload, whether it's from stress, endogenous, or it's something you putting into your body that it's breaking down your tissues. Yeah. Yeah. And I'm trying to hire a tech to help run the chamber. I had someone that was on board, and then turned out she just couldn't do the hours. So I am looking to hire someone to help support us with the chamber. If you know anybody who wants to come on board, they don't need to have a license. It's unregulated as of now. Because it's just like breathing. Yeah, if you know anybody, I would love to bring somebody onto the team to support this part of the medicine. And then also definitely willing to train each of you how to run the chamber, how to put yourself in the chamber, how to put your friends and family in the chamber. I will say that in terms of making this medicine accessible, and that being a huge part of the commitment of Be Well, and in 2022, our nonprofit, we're going to be charging $65 a session for a financial hardship patient, and $80 a session for a non-financial hardship patient. And Urban Wellness, that is the other main clinic in town from a holistic perspective that's treating off-label conditions, is charging like $180 a session. So we're undercutting them by a huge amount. And if somebody has a TBI or a stroke or diabetic foot neuropathy, or they have foot drop, something that's going to need 40 or 60 sessions, that's going to be in our clinic somewhere between 2,000 and 3,000, and over at Urban Wellness it's going to be 10,000. So really, again, trying to make it accessible. Yeah, but $65 a session for financial hardship, one session at a time, for people who need that. Yeah, and our chamber is big enough for 2 people, so a mom and their autistic child can get in. Also not something that many clinics have. And our chamber, because the reason I got the one that's big enough for 2 people is also to try and make it more accessible. So you can tandem dive. There's 2 masks inside the chamber. And when we do that, I can bring the price down for financial hardship to $35 per person. That's insane. That is me giving away this medicine because I want people to get well. So non-financial hardship tandem dive, I think Heather and I decided was going to be $65 last night, but that's still really accessible. So yeah. I want to respect everyone's time. I know we're bumping up against the 11:30 marker. And does anyone have any observations or questions or inspirations?
I had a patient, I was talking, it actually wasn't one of my patients, it was just another patient, maybe one of Travis's, who was in the office, and we were just talking about the oxygen chamber, and I thought I had seen some paperwork, some pamphlets about it in the office, but I couldn't find them. So I was just wondering if there are pamphlets available that we can hand out to share with patients.
There are, I have a stack of them. Like I have one on hyperbarics for TBI, hyperbarics for cancer, hyperbarics for autism, hyperbarics for neurological conditions, whatever. I only have one of each one. So I'm thinking to put them in a sleeve protector and make a binder, because it shows, the condition, what it's beneficial for, and then it has references to the studies. They're really great handouts. So I'm going to put those in a binder to have at the office, because ordering them for like a pack of it's ridiculous. It's like $2,000, and I'm not there yet. So yeah.
Yeah, I have a few patients who I think would be interested in learning more about it, at least.
Yeah.
And I'm definitely not at the point where I have the vocabulary to really sell it or explain it to them. So yeah, it would be helpful to have some samples.
Yes, I will make that binder hopefully this week.
Awesome.
And you can have them do a 15-minute consult with me if you think that they have something going on that would benefit, which is pretty much everybody. Yeah.
Awesome.
I'm actually pretty excited about it because I'm going to my naturopath tomorrow to get the results from my first round of testing for chronic Lyme disease.
Yeah.
So if it turns out positive, I'll probably be hopping into that 45 to 60 treatment trial there. And because I'd rather do that than antibiotics,
Yes.
So yeah,
Yes.
it's good timing if it turns out that I need it.
Yes. And I have 2 patients in for Lyme right now, both of whom their baseline when we started was at like a 4.5. If you just say, how's your life and functioning capacity in general, give me a number for how you're doing, 4.5. They're both around somewhere between 20 and 25 sessions. So midway through the protocol, and they're at like a 7.
Wow.
My one guy, he's like going to the gym. Hasn't been to the gym in 2 years. He's like, I feel so much better.
Cool. Cool.
Yeah. Okay. And if you guys see down here, Rebecca and Rick Seward, these are my parents, because this is the kind of medicine that you have to share with your family, because it's the holy grail of holistic care of our generation. So I have my mom and dad on the call. You guys want to say hi? Mom, Rick? Do you have any questions? They're just saying, they don't have a camera on their laptop. So, yeah.
Okay, can you hear me?
Yep, I hear you,
Am
Mom.
I-
Oh,
oh my
I see you. This is my mom. Hello, my
but
team.
Okay. Hi, everybody. Delighted to be here today. Thank you for sharing it with us.
Yeah.
Okay. Bye.
Bye. Thanks, Mom.
How do I make it do it? Oh, now I have to figure out how to get off.
I don't know if I can mute her or not. There we go. All right.
Okay, I'm off now. So at the bottom,
Need this one.
Dessa, I have a question about the contraindication around the ear congestion. Have you had patients have that come up, and like their way to get around that?
So there's lots of ways to clear your ears. Blow and pinch works for most people, but swallowing helps for some people. And there's like 5 other ways that we have a patient who just doesn't know how to clear their ears that we can educate them around. And then if somebody has like a chronic sinus infection and they cannot clear their ears, they're just too congested, then that day they should not dive. If it's like that all the time and they just can't get clear, then it's not a therapy for them, unless we do chiropractic to release the cranial bones and help their eustachian tubes drain, or we do acupuncture to help support their immune system to fight the sinus infection, or we put them on a neti pot. Like, we have to treat them holistically to be able to get their ears to drain first, potentially for a couple of months, treat their allergies, whatever is preventing them from being able to clear their ears, so that we can get them in the chamber. I do have one patient right now with a pretty severe TBI that I would love to put in the chamber, but she can't clear her ears. And we're working with herbs to try to regulate her immune system to clear her ears, to reduce the congestion in her head first. Yeah.
Thank you.
Yeah.
Dessa, is there information about kind of the rhythms of, like, do you taper in with someone, or do you hit it really hard at the beginning? Do you taper off?
Yeah.
about the frequencies?
So for something like Lyme or a bacterial infection, where we're going to be potentially increasing the metabolic toxins from the die-off of whatever, we might do a shorter treatment. So 30 minutes instead of 60 minutes to be offsetting the toxic overload while increasing their cellular capacity. And then that's only going to be for a couple of weeks before that phase is done and they're feeling better. One way I should definitely mention that, so just going under pressure, that increases the capacity of the free oxygen exponentially. When we add the mask and remove the mask and put the mask on and remove the mask, this stimulates that HIF-1 oxygen sensor, which stimulates all of the cell signaling. So we're actually going to have the person breathe in their mask for 20 minutes, take the mask off for 5 minutes, put the mask back on for 20 minutes, take the mask off for 5 minutes to stimulate that like faux hypoxia cell signaling. So we can moderate the dose by potentially maybe not having them take the mask off if we don't want to have them have too much wound healing. I don't know why we wouldn't want to have them have too much wound healing, but that's a way that we can moderate the dose. Another way that we can moderate the dose is with the pressure. So our chamber only goes to 1.3 atmospheres. There are chambers that go up to 3 atmospheres, which is human tolerance for pressure. And that you would use in the case of like nitrogen poisoning, where you have to get the bubbles out of the tissues really fast, or you're which we will never be treating. But there are doses in the middle of that, like 2.0 or 2.6 in these hard chambers that are going to have increased pressure and therefore increased oxygen absorption. The research right now is showing that there are, I can't even remember which condition does better under 2.6, but basically most of the conditions, even though there are chambers that go higher, most of the conditions actually do better at 1.3 where we are because of the vasoconstriction. You want to have the right amount of vasoconstriction that is still going to allow for really profuse blood flow. And if you do too much vasoconstriction, your brain doesn't really like that. So you start you start to lose the neuroregenerative benefits if you go too high in order to get an even increased, say, like antibiotic property. So, I know that the chamber at Urban Wellness goes up to 2.6 and they might use it for some more serious stuff, but your brain likes 1.3. It doesn't want the higher. Anyway. Yeah, and then I should say that just being in the chamber without oxygen increases your tissue oxygen load by 21%. Just being in the chamber without oxygen. So if we had somebody that were really sensitive, had a lot of chronic fatigue, we just don't want to push them too fast, we could put them in the chamber without oxygen, just do the pressure. And that's still 21% more. That's a lot. When you get in the chamber, when you add oxygen, 94% oxygen, like we have in the compressors, it's, I believe, 238% more oxygen. 238% more. A boom with your brain thinking like, yeah. So think of oxygen to framework it in your brain like a nutrient or like a supplement, right? Yeah. Okay. Yeah, good questions, team. Okay. So we are 15 minutes over. Our next call is January 9th, and we're gonna have all sorts of good stuff for the new year then. And I guess I'm gonna let you guys go. I have my first patient today at noon. But I'm available to have, offline conversations with all of you as well. Yeah. And I sent in the email a link to a bunch of studies, and some websites that really clearly delineate the mechanism of action of hyperbarics. So the two links at the top of the Google sheet that I sent, one really does a good job of explaining the benefits for autoimmune conditions, and another website does a good job of explaining the pathophysiology and mechanism of action for neurological conditions. Definitely review those if you want more information. And then the studies are really fun. I'm just like, what? Somebody did the study and nobody told me? What? Yeah. So, okay, guys, I am so appreciative of each of you. And if you want to stay on for another minute and do a quick checkout and just let me know what you're taking away from today, that would be great. And if you need to jump off, you can jump off, but I would love to hear from any of you what your takeaway is from our call.
Well, I have to run, and I just got the indicator that my battery is about to die because I don't have it plugged in, but I will send you a email.
Okay, kid.
And good to see you all. Nice to meet you. Those of you I've not seen before, and have a great day.
Okay. Any takeaways, Kimber, in your last minute?
Oh my gosh, just every single thing that you just said about the HBOT was like total brain grenade. Just astounding that it's not being more widely used. And I'm super excited about it being more widely used at Be Well. It's really cool. Yeah, thank you for sharing all of that. And thank you for having me. Nice to meet everybody. We'll see you in January, maybe.
Can you hear me?
Yes, I hear you, Heather.
Oh, I don't know what's wrong with my headphones. Are we allowed to just like try it?
Yes, yes. Find a time on my schedule and I'll put you in there. Yeah, definitely.
Okay.
Work. Any takeaways, Evie?
Just ditto to what's already been shared. Dessa, I'd say just with your presentation, you've made a believer out of me. And I'd love to try this and allow and express to my friends how much I'd love for them to try it. It just sounds amazing. Thank you for letting us know this.
Thank you. Yeah. Thank you for being here. Okay. All right. Christo, Mom, you guys are the tail.
Go after Mom.
Any thoughts or reflections, Mom? Are you able to come on? Have you forgotten that you're still here? Yeah, I don't think she's actually there anymore. I think they
All right,
hung up and
I'll
she
speak.
doesn't know how to hang up.
My takeaway is just sort of joining you all in the call. I've been kind of isolated in more narrow psychotherapy world. And I'm struck by things like just that quality, Dessa, as you're describing, taking the mask on, putting it off. There's something about that back and forth that the system learns how to heal. And, in psychotherapy, how do you regulate the nervous system? You step a little bit into distress, not too much. You step into a place that's really well resourced and grounded. And it's that rhythm and it's that back and forth that starts getting the system really resilient, and how so many of our human parts of our systems, our bodies, our nervous systems, our psyches are so similar, the way they work, and they work together, and medicine isolates them. So that was kind of my piece, as well as the ethical dilemmas of amazing treatment modalities like this. And there's like an ethical dilemma of harm by withholding it. And when do you say it's safe enough? There's not going to, the risks of making something more broadly available,
especially for this mind-boggling, which is inherently safe. It's been
Money.
FDA approved for 30 years. Money. Yes, they're hoarding the end of life care to make it super expensive instead of allowing this that actually supports cellular and tissue regeneration to be available. And I think also it's also just been super under researched. Like I think to a certain extent, they didn't really know what they had until it turned out that hyperbarics treats COVID. So, some bureaucracy stuff, some of that, and then some just boom of new research. Yeah. Okay, guys, I so appreciate each of you, and I will have to sign off, but yes, I'm just like into the future.